Hey, Allie, what's up?
Not my hip these days. I'm not up and at 'em on my hip like I would like to be, Shawna.
Yeah, some news, but it's good to get an answer. Might not like the answer in this episode. Allie and I are going to talk about your upcoming hip surgery, my experience with having hip surgery twice, and anyone that has any kind of joint pain is going to want to listen to this because we got some good things to present to your doctor and things that you can be doing to have the most positive experience to
Yeah,
alleviate your joint pain.
and your fears. And before we dive in, we want to give a shout out to our Girls Talk Healthy Aging listener, Miss Lori Stallings. Now let's dive in. Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminsky, and together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
Allie, it's you and me today. I hear you have some news.
News, yes, the news that you know a little bit about. So I'm excited that we get to have this conversation so that maybe it'll help me and maybe it'll help some other folks, some of our listeners that might be dealing with something similar.
Yes, and we wanted to have this conversation anyway, so we thought we were going to hit record, and it's all about hip replacement. And the ladies from Peru know that Allie had some hip pain during the trip, and I know that you've been struggling for quite some time. And it's funny because Dr. Jocelyn Wittstein, when she came on the show, she talked about uh, joint replacement, and sometimes there were tweeners. Do you want to tell us about the tweener and how you were a tweener?
Yes. So, well, first let me say that knowing you, Shauna, and listening to your journey, and then having Jocelyn on have been two big pieces that have helped me figure out some things in this journey. And that's my wish for other people listening. So I definitely recommend that folks go back and listen to that episode. And we'll have to look it up because I don't know off the top of my head which
We'll
episode
put it
it
in the
was.
show notes. Maybe we'll add it
Yeah,
to
we can add it to the show notes. Yes, but I definitely recommend y'all listen to that episode. But yeah, so I am maybe not anymore, but was a tweener. So I'm 49, and I have been dealing with hip pain for. I've been dealing with back pain even longer, but hip pain in particular, my left hip especially, for the last almost 3 years. And when I've been to three surgeons now. When I first went, you get the initial x-ray, you get a shot, and then you kind of go from there. So I went and got an initial shot, felt a little bit of relief, but just didn't get any kind of lasting relief from that.
This was
And
cortisone. Cortisone.
cortisone shot,
Yeah.
correct. Yes. And that was just more like a general shot. Then I went to a different doctor and did another through this process, and I may not get all the pieces exactly, but through this process, somewhere along the line, I got or I got an MRI. Then I got a second MRI with contrast because they just were not able to see exactly what was going on. And they suspect a labral tear. They also, I looked at some of my different notes today from some of my appointments, and they mentioned osteoarthritis in one. They mentioned hip dysplasia in one. They mentioned the labral tear. They mentioned, there was one other thing, it'll come to me, but there's just kind of different, and different doctors report things a little bit differently. Um, and I just got referred to a new doctor recently who I went to see because, and this is thanks to you, Shauna, one of the things I learned from you is that there are different approaches to hip replacement surgery. And at first, I was not a candidate for hip replacement, and I was actually disappointed. And I think that shocked my doctor because most people, we go to the doctor and we don't know anything about this stuff. We just go in and we're like, okay, my hip hurts, help. Okay, I got a shot, now I'm back, my hip still hurts, help. I'm having trouble getting around. I've done some physical therapy, so I've done all the things. I've done a shot in my joint, and still, some relief. I've gotten better over time. I've learned to compensate better over time. And I think being a strong, healthy person certainly helps to compensate and get around and be able to do things. Because some people would never know that I have this going on because I've been able to mask it. But I know because I feel it. I can't sleep. Every time I move, it wakes me up at night because it hurts. And so at first I was going to, the second doctor I went to, they talked about referring me to a different doctor that would do arthroscopy because that doctor didn't do that. He did more replacements. And so time went on and we talked about, I came back. That was when we did the second shot. And then I didn't have much relief from that. So I came back and he did another x-ray. And as this process has gone on, like I said, it's been almost a 3-year process now. My hip was worse. I had less cartilage, more bone on bone. And so instead of arthroscopy, now I am a candidate for hip replacement because like you said, I was kind of that tweener. Because here's the thing, had I gotten hip arthroscopy done initially, I was going to have to get hip replacement eventually. This was not, and the thing that I didn't like about that and why I waited is because I did not feel like the outcomes were as good for the arthroscopy as the hip replacement. And again, I felt like I would just be right back here needing another surgery.
Yeah.
So here we are.
And your doctor might have been surprised that you were disappointed that you didn't need joint replacement because most people are happy. It's like, yay, I don't need joint replacement. But the good news about joint replacement for the hip, especially when you get the anterior approach, is that yes, it is a major surgery. There are so many considerations, and I don't want to be painting all rainbows and butterflies, but it is one of the easier surgeries to recover from because the anterior approach, as we've talked about, is muscle sparing. Mm-hmm. So when you talk about what's actually done, it sounds pretty gruesome, but all joint replacements are carpentry to a certain extent, but it's also snipping of tendons and muscles. And with the anterior approach on hip replacement, basically what they do is I have probably a 6-inch incision at the front of my hip. They pull apart the muscles, yank out the head of the femur, chop it off, put a prosthesis, put a ceramic cup in the acetabular part of the pelvis. They screw that in and then replace it, like put the head of the femur back into that joint socket. And yeah, make it sound like, hey, we'll just do it in my garage. I know what to do. So, but medical technology is so incredible. Mm-hmm. So, we thought that it would be helpful for our listeners who might be experiencing any kind of joint pain to hear about, like, I know, Alli, you have questions. Mm-hmm. And I think the biggest question that people might want to have answered is, like, what kind of pain? So first of all, can you describe your pain? And then I'll also describe my pain because I've had both hips done. What's your pain been like? Where is it?
Mm-hmm. So I have more on the front side of my hip, more probably most of the time. Trouble like lifting my legs up. Any kind of hinging is very painful. Deep squatting is not so fun. Even walking can be a challenge at times. I've had I've had periods where I really was limping around, and I've had periods where I can walk a little better. And so, that has been troublesome. And then and it's a chronic thing. It's not like it goes away. It's not like, so I have not taken a lot of like a leave or those type things either. So I feel it. I'm not masking it. I'm letting it, letting all that pain just be there and do its thing. Because also pain is a way of letting our body kind of know what not to do and where not to stress or what's too much. And so, sometimes if we mask our pain too much, we can certainly make things worse. But yeah, so mine has gotten worse because I've been living on a joint that is not healthy.
Yeah.
It's not full. It's
Kind of
not
crumbling.
complete.
Yeah.
And one of the things that I feel like I'm very similar to so many other folks in is that there are a lot of fears about having some type of surgery done. And one of the things I can appreciate about talking to you about this, Shawna, and you and I have talked about this throughout this process, is that you also are in the fitness field. So there's also that added challenge of we have active careers and our livelihood is dependent on our joints being available to do the things.
Yeah.
And then I also just enjoy moving and I enjoy doing active things. And so that's another fear that I have is because even though I do those things in pain, I still am able to do some of those things. Now, my activity level has dropped by at least 50%, if not more, at least. And so it's not like I'm, living my best active life. However, I'm not where I can't move. And so there are those fears about having surgery and having some type of problems, whether it be recovery being longer than I would like, slower than I would like, or having some kind of complication that is going to permanently limit my ability to do the things I love.
Well, the thing I would say is that if you don't get the surgery, or anyone that is considering delaying it or not getting it, eventually you will permanently not be able to do those things. So there's that. The other thing is that even if you delay, you're pretty young. You are 49, so you're a little bit younger than I was for my first one. I was 58 for my first one, which is still pretty young. And I also, I'm going to make an aside here to say that your lifestyle, my lifestyle as an active person, as a weightlifter, you're a resistance trainer, you're an aerial acrobatic, you do all the things. It is unlikely that those things are the things that wore out your hip. So I want to just say that outright, that we can thank our parents, we can thank our hip joints, for that, not our lifestyle, our active lifestyle. It's that. And then secondly, what I want to say is that yes, over time, if you didn't have the surgery, you would permanently not be able to do the things you love. You would lose quality of life. And given that you are young, there is the concern maybe in the back of your mind, because these are the things that went through my mind, and even my own doctor said you should wait because you're young. But then I talked to my surgeon, and he, his thought, and I concur now after having been through it twice, is that the compensations that you're going to acquire to make way for that pain, the loss of muscle and function and ability, is going to aid you a lot more than what that surgery is going to do. And medical technology has advanced and is advancing at such a rapid rate that by the time I need new hips, if these joints ever do wear out, you know what? I think I'll probably be in my 80s. I might not be. I might not be, who knows, weightlifting at that time. Whatever I'm doing, the medical technology is going to be advanced such that the surgery, the intervention at that point is going to be even better. So, and delaying surgery by 1 or 2 years because you think I should wait. So maybe you're going to wait till you're 50. that deterioration and loss of quality of life and the mental load of not doing the things you love.
Yep. Yeah, and I can definitely tell I'm not as lean. You know, I'm definitely having to be a lot more careful. Not in the living. I'm already not living in the same body that I was before this started bothering me. I'm
Yeah.
already much less active. I'm already missing out on a lot of activities that I cannot do right now that I would like to do, or I'm doing them but not doing them at the level that I like to do them at. So it's you know, it is affecting my mentality. It's affecting my quality of life for sure. It's just no fun to live in pain.
It's
And
exhausting.
it's exhausting to live in pain. And one of the, I guess, blessing curses, I don't know, of working with women is I get to see women doing different things and making different choices and living in different bodies and going through different things. And I've seen, and not just even clients, but also family members. And I've just seen people that live in pain for years and years and years. And especially as women, I think we tend to be susceptible to just living in pain. We're tough. We are tough, and we will just keep on living in pain. And I've done some reflection on this about the whys of that. Why do we do that? And as I've gone through this process of meeting with doctors, I've had a couple of ahas. And I think one of the things that, and this may be something we may even discuss a little bit. I don't know how much differences there are with our healthcare here versus, you know, how that goes when you go to a doctor. But one of the things that I know here is that we don't get a lot of time with a doctor. And because of that, we don't get a lot. I mean, I have a client now who she's having hip issues and she needs a hip replacement, but she went to the doctor and he didn't even do an MRI. And now she's 70 and he just said, yep, you need a hip replacement. And it was very quick appointment. And she, of course, had questions. She wanted to kind of like do some like, how do you know this? You know, and so she left feeling, she went to physical therapy, which she didn't need to be doing therapy on that hip because it wasn't going to help. But because she did not get any kind of real education in that appointment, and I think as women especially, we can feel like we get dismissed or overlooked and I don't know I'm not saying this is just not that this doctor would do anything different with a male versus a female, but I think that just as women, we can feel that way because of other experiences, maybe with medical or just in life in general, that we don't feel like we're being heard or listened to, or we just don't have that conversation that us as gals, we kind of like to know a little bit more than, yep, here's what you need. All right, we'll set you up. You know, and like, wait, what? You know,
I've got questions.
Explain to me what are you seeing? You know, because we are not medical experts, we're not surgeons, we don't know all this terminology. And not only that, another aha has been how that, especially here in the States, and I'm speaking from in Georgia, my experience in Georgia, this may not be everywhere. But there's not even a talk of, okay, Ms. Kerr, let me go over the different types of hip surgery that are available to you. Yeah. No, it's just you call, you have hip pain, you get put through this little chain, and it's kind of the insurance chain.
It's like, oh, what are we doing? You don't even know until maybe you're on the table, unless you have questions to ask.
If I didn't know you, Shawna, and had not talked to you about your hip surgery, I would not know that there was an anterior approach and there was a posterior approach.
And there's actually a lateral approach as well.
And there's a lateral approach too. But I would not even know that. I would have just gone in and they would have put me with a surgeon and I would have gotten the approach that surgeon does. And they would have never
for you.
They would have never asked me any, you know, or given me a choice in that. Yeah. And even the like the things that they use in that surgery, the type of prosthetic that I'm going to get in, none of that is ever explained to us. It's just you go with what that surgeon does and the company that they use and the materials that they use. And there is and we don't know to ask. We don't know to ask. Yes. And and this is just hip. Now, I don't even, if you're talking about shoulder, it could be a whole different thing. But this is specific, right now to the hip. So those ahas of just, and I know that here, and I can speak for in America, I hear with people, with the ladies that I see, how much distrust that we have for our medical world, and I think, and also you're also left, one of the things I've also learned through this, or at least this has been my experience, is even when I called to go see this surgeon, I made it clear I am going to have surgery. I want to have anterior. I was referred to this surgeon by another surgeon because I told that surgeon I want the anterior surgery. That surgeon did not do that surgery or feel as comfortable, so he referred me to this guy. And so I said, I'm coming down to this appointment and I want to meet with the surgeon because, yes, you can put, like, well, we can schedule you with the nurse practitioner. I'm like, that's fabulous and that's fine. And however, I want to meet the person that's going to be sewing on my hip. I want to make sure I'm comfortable with this person and that they understand my lifestyle, my goals, what I want to be able to do after surgery. And so then I got there and I was meeting with the nurse practitioner and I just asked, I said, am I going to get, I made it clear on the phone with them that I want to meet with the surgeon because, I'm not scheduling a surgery until I've talked to this person that's going to be doing this and I feel comfortable with them. And so they're like, yeah, I can go get him, and you can talk. So I ended up getting to talk to the surgeon. But again, if we don't come in with these questions, being an advocate for ourselves,
100%.
we're going to get kind of shuffled through the normal process. And another thing that was funny to me while I was sitting in there with the nurse practitioner, before the nurse practitioner, or maybe it was when I was waiting on the doctor to come in. Anyway, I saw my notes on the screen. They have like your notes up from the last appointment. And the last surgeon in the notes had the statement, had a lengthy discussion with the patient about blah, blah, blah. And I just laughed because the last time I've had a lengthy discussion with any doctor has been like, I don't even know when, like never. I don't know. Because we don't get that here. And again, I don't know. I'd love to hear from your experience. But here we don't get a lengthy discussion. And I laugh if you get like 7 minutes with the doctor, I think must be considered a lengthy
good time
discussion with the doctor here.
Yeah.
So I thought that was kind of funny and interesting. But yes, I'd love to hear did you have any kind of, because I feel like you were more knowledgeable, and I don't know if that was just because of your own curiosities or what you've done with maybe a physio or what, or your
I think it was a bit of both, because my family doctor was, even though he said, it's your decision. I respect whatever you choose, because he's retired now, but he really appreciated my health and how I valued it. I was always in for checkups and compliant, and he would ask me about lifting and like what's going on with my life. So he was kind of an old school doctor. And in fact, my new doctor, also very attentive that way. I can get 15 minutes to a half an hour with them. I feel very fortunate. And so it might be Canadian healthcare or Alberta healthcare has the opportunity to extend those appointments, or maybe I'm just lucky. So I'm telling people that in Alberta, it is possible to be able to find a physician that will listen to you. And at the time, the first hip replacement was 21, the second one was 23. And at that time, you could not get private health care in the province that you paid for public health care. And if I wanted to wait for the province, my insurance to cover, because I just have like Alberta Blue Cross, and especially because of COVID, I would probably be waiting 3 to 5 years. And given our lifestyle, Alli, I was not signing up for that. I had only been in pain for about 6 months, and my pain was somewhat inexplicable. Sometimes it was at the front. Sometimes it was in the glute.
Yep.
I had physical therapy. I had acupuncture. I had, dry needling. Like I did every modality, and I had cortisone. I got 5 minutes of relief and then back to the same old, same old. You do not even need an MRI to determine if your hip is arthritic or you have bone degeneration. All you need is an x-ray. So finally, when I went to my doctor, he said, we just need to do an x-ray. So when I went in, he said, your hips are arthritic. The right one is worse. I can't remember which one was worse. Just a second. You're stressed. I had to look at my scars. Okay, this one, my right one was my first one. And he said, your right is the most degenerative, but you're going to have the left done eventually, which is also determined.
Yeah, and my right's probably going to have to be done. Yeah, and I'm already feeling it. And I don't know if it's just from the compensation or,
a bit of both probably, right? So then I explored private options. So for me, that was to go to Ontario. And so to be clear, I paid for surgery, and I think I might have had a better experience because I was out of pocket for that.
Right.
And I've had friends that have had hip replacements within the province. A friend just is recovering from one now, and I think she had a positive experience, but she was also armed with the questions because I'm like, okay, here's the questions. You're
right.
So she went in with some knowledge, and I did some research on my own, but then I had an opportunity to talk to the nurse practitioner. I met my surgeon. He was aware of my lifestyle. And so I felt very comfortable because I had the opportunity to have all my questions answered, which I think is really important. But even if you're kind of being sidelined, I think you have to be the squeaky wheel.
Yeah, and I think that can be tough for us gals for whatever reason. I mean, I know that there have been people that have done research on this about women not asking questions when they go, or gosh, how many times have you gone into the doctor and you forget all your questions? And you leave and you're like, why didn't I ask? I mean, people write them down. Of course, we do all that, but even then, sometimes you can just get where I know I've even felt like when I had questions written down. And then I get in there, I'm like, well, that question doesn't make sense. Or, you just start questioning yourself. And it's such a fast, you feel like you're being I don't know. I think that for me, I will speak for me. Sometimes you feel like you're so rushed and that they're really, at least here, like I said, in the States and in the system that we have, a lot of times, you do feel rushed, and I will say it was not a lengthy discussion, but I do appreciate that the second surgeon that I went to did spend a little bit of time with me, more than he probably does with most of his patients. But that had to do with the fact that I was asking. I was asking these questions, and I came in saying, and I told him, I said, I'm not letting anybody do posterior hip surgery on me. I just flat out, and I don't know if I offended him because I don't know if that's what he does or not, but I know he referred me to a different doctor who does anterior. So, and he did listen to me, and he did give me a little bit more time. And so, and then the same thing with the doctor who's going to do the surgery. I feel like he did, because I was more informed, I got a different experience than had I not been. Because when you don't know, you don't even know what questions to ask. You just don't even know.
And so, what I would suggest for anyone, I mean, I feel like the Pied Piper of hip surgery because I have a lot of people that reach out to me, and I am more than happy to talk to them about it because I had a positive experience. I can make suggestions about what questions to ask, what recovery is like, that kind of thing. So I'm always happy to be a resource. But ChatGPT, you could even type into ChatGPT, whether it's like not just AI in general. So I'm facing hip surgery. I'm facing reconstructive shoulder surgery. Like, what are the questions I should be asking my physician, my surgeon? so that I can have the best outcome. Like sometimes you don't know what you don't know, but other people, or that's when we can kind of tap into AI to help us with that.
Yeah.
And I mean, here's something else that I would, it's up to you, Alli, but I talked to my surgeon and I said, I don't want a general. Can you just do an epidural? And so, like I even asked for the type of anesthetic.
Yeah, but that you want, yeah.
Because it's,
and he did say he was going to do the epidural.
Yeah.
So I did get that information, and he's going to do staples. That's something that he recommends, and then another thing that's interesting to this process that it kind of reminds me of some of the things that we deal with in the health and fitness world. But there's so many things coming out now, there's nothing wrong with I've gone to the chiropractor, like you said, you've done acupuncture, you've done physical therapy, we've done all these things. One of the second doctor, the surgeon I went to, he's actually getting out of surgery. I'm not really sure why, but he even recommended that I do this new method, test out this new method where they take fat from your stomach and they put it into your joint. And it can possibly give you some relief, but the insurance does not cover it, so you're paying out of pocket. Who knows how many times you're going to have to do it and if it works. And then the third surgeon was like, yeah, there's no proof that does anything. Which
is pain and suffering you would have gone
and the money that you spend just kicking the can down the road on these exploratory type therapies that are available, and nothing. I mean, listen, if people want to test out different things, but I do think that and I think that one of the reasons we do that is when we go to, especially when you go to some clinic that's a self-pay, they are going to take time with you. They are going to listen to you. They are going to hear about what's going on with you and make us feel heard. And they're going to offer you a solution that sounds promising. And and who knows, maybe that is promising to some people, but I just came to the realization, it just didn't even, when he even mentioned it just didn't. He was like, you can take this and do some research on your own on it. I'm like, no, I can't. I really can't, because what the heck do I know about this? Come on, and so I didn't feel good about that at all. I was like, that's going to be a no. And the third surgeon,
you would have been the guinea pig.
Exactly. And the third surgeon was like, the only thing that's going to fix your hip is a replacement.
Yeah,
here's your X-ray. Here's where you're bone on bone. Here's the bone spur on the side of your hip. And so, and you talked about the X-ray being, and so, I had the MRI initially because, it started as a labral tear and then it advanced. So, but for some of this, I think that was why my client that was, they were able to see enough from her X-ray, and she was confused why they didn't do an MRI. And what was going on. So, but that could have been explained, and she ended up getting an MRI somewhere else. But that could have been explained to her if that surgeon had taken the time but maybe he didn't know that she needed, because on the other hand, we also do just kind of blindly trust the surgeon, because again, like I said, a lot of people, they don't ask what kind of hip surgery am I going to have? Are you going to cut me in the front? Are you going to cut me in the back? Are you going to go through my muscle? Or are you not going to go through my muscle? Because we don't even know those questions to ask. So there is we have to have some blind trust in there at some point. And I know that's one of the things you said to me, Shawna, was at the end of the day, Alli, you got to trust your surgeon.
Yeah. But you're going to have that trust once you've had some opportunity to question. And I am not slagging or throwing shade on surgeons in any way, shape, or form, because they're doing their best with the time.
And we need them. We need more of them, because there's so many of us with issues, which is why they're so busy. One of the reasons they're so busy.
Yeah, and they are doing their best with the time that they're allotted with their patients. And I know America is different than Canada in terms of healthcare, and it is what it is. And I had very positive experiences, and like I said, I don't want to paint a picture that it was all rosy, but I want to say I was lucky, but I made my own luck. And this is how I did it. And number one, you're doing this already, Alli, is you're super active. You've not
Mm-hmm.
just sat on a couch for the last 3 years to just waste away. You're actively, and especially for hip number two, I knew that, hip number two was going to have to be replaced. But in the meantime, I did a lot of my own, prehab physical therapy to keep that femur centered so that it wasn't, wearing away on different aspects of the bone. So and I still do. I go for physical therapy every 6 weeks. I have a standing appointment to what's the ache or pain? What can I work on? So number one is prehab and being active. And the other reason I was successful with my recovery is that it was my job. Yes, my job, your job, Alli, is you have a job of a physical nature, but I didn't have to do my physical therapy. Like, I could have slacked off
Right.
that, but I had a bigger vision. I had a bigger picture of like, what do I want to do? I want to get back to weightlifting. I want to be training my clients. I want to be able to live without pain. I want to hike and bike and do all these things. And I ate like an athlete, because the tendency, I think, for people sometimes is when they're not active, because you're not going to be active for a bit of time after your surgery, is, sometimes people are sitting on the couch, and so the ice cream, the chips, the popcorn, the chocolate, that, I'm not saying I didn't have any of it, but I ate, like, your body needs nutrients. So anything that went in my mouth was like, is this going to help? So I wasn't, entirely like I said, it's not like I didn't have treats, but I ate well. I didn't calorie restrict, even though I was less active, but your body needs energy. And I slept a lot. I rested.
Mm. Yeah, I remember you talking about this before, and I think this is such a good thing for people to hear, because I think that, people still have this idea that you and I, Shawna, can eat what we want. We don't
Yeah.
just have these great metabolisms, and we can just. No, my body has changed since my hip has been janky, because I'm not as active, and I've had to be more mindful of what I'm putting in so that I don't get, that doesn't change even more and I don't gain weight. And I remember you mentioning before that that was one of your concerns about the surgery, was you were worried that you were going to gain weight. And so you went into that already with a plan of like, how do I, fuel my body, but how do I also not make sure I don't gain, a lot of weight, because you're
Yeah.
not going to be active. You're going to be recovering, and
Yeah.
the movement, your steps, your movement went way down during that period.
Compared to, yeah. I mean, it had gone down a little bit, especially for the first one, just like you, because of pain. But
Mm-hmm.
I went in for my second one. My pain level on a scale of 1 to 10, that's how they always ask, was maybe a 2 at tops, and not even all the time. But I knew the end of the story. So I was proactive and said, hey, why am I waiting on this? I got a frequent flyer savings because I was going for hip two. I went to the same surgeon because I had such great success. He knew my body. And so I was very active with hip number two going in. But I think, and I think I put on probably maybe 3 or 4 pounds, which for me is a lot.
Right, we're small people. Yeah,
Yeah.
a pound is, you see it. 3 pounds, you get, you feel it, you
Yeah.
see it. Yeah.
And I'm
It
just,
could have been a lot worse if you were just eating popcorn and cookies and
yeah, but it's just like, nope, this is what it is. I'm just, and my shape has changed, which I don't really like, but it's like, wow, I'm so functional. And it's more than aesthetics. It's about health. So lunch is sometimes my hardest meal, just because, I don't know, it just is for me. So it's just like, no, I made myself have like a real lunch. I made myself have a bit of a lay down because or like quiet time, because I was tired. My body was tired. And you know, you're almost 10 years younger than me going into this surgery. And I don't want to say that, like, I don't want to say that as you age, you just slow down, but you do a bit.
You do. Yeah.
There is a
I
certain,
see it with training ladies at different ages and stages. Yes.
yeah, and I feel it. I need more recovery.
Yes.
So my lived experience was that, hey, I got tired in the day, so I made accommodations for that. So it's like, oh, maybe I'm having some laptop time where it's just quiet time. I just made time for that. And then also with the recovery, you know, you're going to get some recommendations from your doctor, which for me and for you, Alli, like, you're not the typical hip replacement patient. So I don't want to tell anybody to say, oh, to heck with your doctor, I'm just going to do what these ladies say. I know for me, I knew that I was capable of doing just a little bit more.
Right.
So it was kind of like a dance of, oh, that was a bit too much. Oh, I think I can do a bit more. After hip number 2, 3 weeks later, we went to Alan, my partner's place in Mexico, and I was walking 10,000 steps a day. 3 weeks later.
Wow.
It's flat. It wasn't, you know, we weren't racing it, but like, and that was good for me. Movement, motion is lotion. You know, things like deep hip, like, well, you can't do deep hip flexion. This is what you can expect, Alli. Imagine wearing the tightest of jeans and putting your phone in your front pocket and trying to bend. It's just tight. It's just stiff. But you have to, like, once you get the go ahead for hip flexion, you have to kind of just push that a little bit. It's like, if you don't push that, you're never going to get the hip flexion.
Yeah. Yeah, I want to ask about, because this is one of the reasons, especially one of the things, the thoughts, especially as a woman, you know, you mentioned the aesthetics of it. That's one of my questions is, what is different aesthetically after hip surgery, since you've had both? And is it different one side versus the other? What's different?
Probably nobody notices, because I've mentioned this to my daughter Hannah, and she just like rolls her eyes like, Mom, you're crazy. But like, I'm very like boy like. I never had hips. I was very straight up and down, and now I feel like I have a bit of a hip, if that makes sense. Like, it's just a little bit more of it. And I'm just like, it doesn't look like me, because when I look in the mirror, and now it's even on both sides. Like, I feel like, you know, probably no.
You got some hips out of this.
But I did get some hips. Yeah.
Girl, I already have plenty of hips. So if I get more hips, I don't know.
But, and then it's like, I know, I just feel like, because now my hips are a bit wider, that my butt got a bit flatter. Like, when they were narrower, it stuck out more at the back.
Yeah.
So, but I probably also lost some glutes, and I've been working, you know, work really hard you know, most people lose their glutes with age.
Yes.
We don't do enough. So it's like, it might be a bit of combination, but like, I really work hard to have strong glutes, and nobody would notice that my hips are different, but I do.
You have great hips, Shawna.
Well, thanks, Alli. I kind of feel, I feel like, oh my gosh, Alli spent too much time with me. Now these hips are contagious.
Well, people would say, like, you were, I think you said 58 when you had your first hip. They would say that that's, you know, people would think that that's young for hip replacement. People would think that 49 is young for hip replacement. Yeah. But one of the things in my, just doing what I do, is I just see women that probably should have had things done earlier, so many years ago, and they just never do.
Check. Yes.
And they never do. Yeah, and we're living longer, and we're living active longer, and so as we should, and so, you know, that's, you know, and we'll have to do who knows how this surgery is going to go. We don't know.
No, it's going to go. This is what I set my mind on, Alli. I never entertained any idea that anything adverse was going to happen.
Yeah.
I had,
Good for you, Shawna. I'm not going to lie and say I don't have fears. So,
I had
knock
fear.
on wood.
Yeah, I mean, I had fear,
Yeah.
especially going into hip number 2, because I basically had no pain. So I was signing up for, being a little bit uncomfortable. But for most people, and I think this is what you're going to find, Alli, most people that go into hip surgery, they come out of it and they're like, wow, this recovery is less painful than what my hip was prior to surgery.
Mm-hmm. Yeah. Yeah. That's what I've heard people, I've heard people say that. So yes, that's what we are hoping, wishing, thinking, putting out there to the universe that will
Yes.
be the outcome. Any other thoughts that you have for people that maybe living in pain or maybe have gone and really didn't feel like they understood or really knew what to do next? Any thoughts for folks?
Yeah, Alli, like you said, is ask questions, ask AI, ask AI to make a list of questions. Stand up for yourself. Maybe take an advocate with you to an appointment, because sometimes you might forget to ask a question, but whomever you bring with you might be able to ask questions. Write down questions, take a notepad, write down the answers, because often you forget, and ask for follow-up. Like, be the squeaky wheel, because otherwise, like I said, healthcare workers are doing the best they can with the time that they have.
Absolutely.
So if
no bad thoughts for that, for sure. We want to make sure we don't sound like that. Yeah. I mean,
but
we have an aging population, and a lot of people have put things off, and so now it's not just one problem, it's 5 problems.
And that's the other thing I was going to say is, don't put it off. Because when you put off something like a knee replacement or hip replacement or whatever it is, you end up with compensations. You lose quality of life. You become less active. And then that can affect your metabolic health. It can affect your mental health. And as we age, there is a decline, but we don't want that steep drop off a cliff.
Yeah. And I want to say there's not something wrong with you because you need a joint replacement, in the sense of, I had a client who asked me, is there anything you would do differently, in your life as far as like needing to have your hip? And no, the answer is no,
Same.
And yeah, I mean, like live in a bubble, like bubble wrap? No, I mean, I don't, and still, I think that joint issues run in my family, and
my mom had her hip replaced.
Yeah, I was looking at different people. Like Madonna's had a hip replacement. Like Jane Fonda, I think, has had 2 knees, 2 hips, and a shoulder, or something. She's had several. Oprah's had 2 knee replacements, and they may have had more. But one of the things I said to this client is, and I'm, that perimenopause age, your whole body just dries out. Everything. I mean, it really starts deteriorating as far as just
dropping your estrogen, which is an anti-inflammatory.
Yes. So it does affect our bones. It affects our cartilage. It affects the things, the fluids in between our joints. And so, one of the things that I said to this younger client is that, we're probably, I mean, I don't want to like wish this on anybody, but if we live this life and we make it, into our perimenopause years and beyond, then unless we just ignore pain and live with it and don't ever have anything done, we're probably gonna have something.
Yeah, we wear out. I mean, think about
our parts. We are outliving our parts.
Yeah, and if you're using your body as you should, there's repetitive use injuries that happen.
Even if you're on the computer, your wrist, your fingers.
Yeah, and that's kind of the most sedentary. How many people have carpal tunnel because they sit on their computer?
And spine issues from sitting, and
Yeah, so I mean, ergonomically, see if you can get the best movement patterns with some coaching, which is helpful. Like I have reconstructed, say, my squat pattern to accommodate my hips, but probably prior to then, I might not have had the best squatting pattern. So, but
I just want to say, like, it's not that you've done something wrong that
correct.
now you have to have a joint replacement and someone else did all the things right.
Right. And they don't have to.
Yeah.
Correct. Yeah. And, now in my 60s, it's like, well, like I'm knock wood, things are feeling good, but if as I continue to be active, other things will wear out and I will just get them repaired, deal with them as I go. But I'm not going to sit on the couch. It really bothers me when someone gets a frozen shoulder and they don't address it. And then it's like, well, I guess I'm just moving that coffee cup to the counter because I can't reach overhead anymore.
Yes, I have clients now that they can't do this, but they won't go get it addressed because I think that I feel like we did something wrong, and like we might not really realize that we feel that way, but maybe. And two, there's fear, of course, the unknown. We feel like, because we hear horror stories like, oh, if I go in to have my shoulder, and then I'm going to not ever be able to use it again, and it's also going to affect my neck, and so we have these fears.
I have a client who has chronic knee issues, but is not interested in any kind of therapies because her dad had a bad experience.
Yeah, and I think that is legit. The legit fear for folks.
Yeah,
they've heard about something or had someone, and that's what do we do about that, Shawna? What do you recommend? That if someone is feeling like that, they're just like terrified.
Yeah. And
they're going to have a bad experience and a bad outcome.
Yeah. But what is their outcome by not doing something? A bad experience and pain. And knowledge is power. So understanding that what happened 50 years ago, which was literally 50 years ago, medical technology has advanced since 50 years ago. And this person that, this client is very healthy and, takes care of herself. And 50 years ago, like our parents, no shade on them, they were putting food on the table. They weren't going to the gym. It was a different time.
Yeah.
So.
And you don't have to go to just one doctor either, like.
Yeah. Yeah.
For one surgeon.
Investing. If it's like, well, I have to pay to see a second doctor. Guess what? If your car, would you pay to go to another mechanic if you didn't get good something from your mechanic? Like, we take better care of our vehicles, and our vehicles wear out, and it's like, well, you need a new muffler, or you need I don't know anything about cars, but you need something. You get it.
Some new shocks.
Yes. So I think it's important to be educated, consider like investing in your health, and ask a lot of questions. You have to be an advocate. And if you don't know how to advocate for yourself, find some support to help you do that. Your wish, Alli, if you had a wish for our listeners, what would it be?
My wish would be, if you've had a pain, that if you've got something that's not functioning and it's affecting your ability to do things, and you have a pain, that you go to however many doctors it takes until you get clear answers and a clear plan of how to get more function and reduce pain.
And my wish, first of all, to you, Alli, is, we're going to have a good result. Obviously, to you is my first and foremost wish, and I wish I could be there for you. But for our listeners is the same thing. Knowledge is power. Ask questions. Be an advocate for yourself, and just be that squeaky wheel. You can be I was a squeaky wheel, and I'm sure you are too, Alli, because we're asking reasonable questions. Just be reasonable about it, and you will get answers. And if you don't stop until you do.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness. And you'll find me, Shawna, on Instagram at Shawna Kaminsky. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, Please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.